Hello, everybody, and welcome back to the Health Optimization Medicine podcast. We have our faculty here with us today in person in DC. Very excited to be here with all of you. So today, we're going to talk about chronic disease is aging. That's the title. And we're going to go through this. Very excited about it. Leading off, how would you like to start this up?
Well, recently, Dr. Ted explained to me research from the SENS Institute showing actually how we currently think about what chronic disease is. And that chronic disease is actually not a separate process from aging. Why do some people age faster than others? Why do some people develop diabetes or heart disease? So when we look at what makes us, we talk a lot about metabolism and metabolomics. And that's the process that actually, keeps us humans functioning well. But inherently, metabolism is flawed. Metabolism produces waste like reactive oxygen species causing lipid peroxidation. And your body has natural repair mechanisms to repair misfolded proteins or repair damaged DNA. But at some point, that damage starts to accumulate. And when the damage accumulation starts to exceed the rate at which it can repair, tissues start to break down.
Right.
You get structural damage and then eventually pathology. That's when liver cells actually start to break down and we can measure things like liver enzymes in serum. And that's where disease markers appear and illness medicine actually has something to diagnose and treat. But what if we could actually measure metabolism going or deviating from its optimal values and intervene there even far before pathology becomes an issue?
This is a model by Aubrey de Grey, right? Formerly of the SENS Foundation. He's with another foundation now. He says that we have classified diseases all wrong. The previous classification, as Jup has said, has been to classify diseases as congenital, infectious, or chronic, and then aging as, frailty, sarcopenia, and all of those other things that go along with older age. Now, he says, we can put chronic diseases under aging because what drives aging is actually metabolism, right? Your metabolism, and then it produces damage, and then it produces a pathology. So what he proposes here is that since metabolism is like a spaghetti of undecipherable pathways, why don't we do the damage part? And Alan and I were just talking earlier about MSC replacement therapy, and these other
Mesenchymal stem cells, you mean?
and exosomes and all of these other newfangled things that you hear about. Those are already in the process of repair, so they're not foundational; they're repair mechanisms already. So. Fortunately for us, the clinical metabolomics as a research subject came out of research and went into the lab and is now available to clinicians. So now the metabolism spaghetti that Aubrey de Grey was talking about is no longer spaghetti.
Like spaghetti, like you're looking at those diagrams and it's like the entire picture is metabolism. You're like, what the fuck?
Yeah, and the you can now measure what the fuck these are.
Yes, exactly.
So, as I like to say, we as medical students, we just used to memorize this
Memorize
stuff.
it, yeah.
And the question that I hated the most from my patients really is that, Dr. Ted, is vitamin E good for me or is vitamin good for me? We can now measure all of those. We don't have to guess, right? So we can actually guess the levels of all the anaplerotic reactants in the Krebs cycle, right? So now there's no more excuse. Right now, what was once a theoretical biochemistry is now actually very clinical biochemistry, very different from the clinical biochemistry that's being taught to us, which is urinalysis, blood assay, and all of that kind of stuff.
Yeah. Well, that makes you think of a couple of things. I was actually talking to a stem cell expert just a couple of days ago, and the best stem cells that are going to last the longest, maybe 6 months, maybe a year, right? Because what's actually at the base of all this is how well your cells are functioning. Metabolism, as you said, right? And so as he was describing it to me, it's like we need to prime the body, we need to inject the stem cells, and then we need to do this sort of pattern of closing it up so that you make it work as best as possible. But if you don't do that priming, which is really what metabolism is all about, you're left with a system that's getting infused with things that's running on McDonald's and alcohol. It's not going to go very well.
Well, Alan and I were talking about this earlier.
Yeah, it's interesting, right? Someone will come in and they're willing to drop 20 to 30 G's on, I don't know, 100, 200 million stem cells, thinking that this is the savior. And, when we back up and we ask ourselves, okay, if stem cells are coming in and the repair mechanism, we have to ask ourselves, is the body even in a state where it is able to repair itself, right? Can it recognize that it's time to repair? And this goes back to Naviaux's articles regarding the cell danger response. For those that are listening, you'll hear us talk about this over and over again. It is the cell's ancient defense posture in response to threat. And we can talk way more about it, but essentially, just to simplify it, we have on one spectrum, when the system is under threat at the cellular level, everything with regard to growth, the repair, restoration shuts down, because if you're under threat, right, you need to focus on survival. Everything else that's not important shuts down. And then there's a spectrum to which when there is an abundance of energy and the threat's low, that the body can now start to repair itself. So if we take this concept and apply it to, say, stem cells, if someone comes in and they haven't had an assessment as to where they are in the cell danger response, is their body in a threat mode or is their body in a growth mode? And you now give something that's repaired, it's likely just a waste. And if you talk to anybody in the stem cell industry, what they feel, other than it's very lucrative.
It's the Ferrari.
It's the Ferrari.
They're giving him a Ferrari.
They're giving this Ferrari. Yes, inside joke there. But what they'll see is that some patients, some clients do not respond at all, no matter how many stem cells you give them, no matter how frequent.
Even the coolest, newest,
even
most awesome stem cells.
Exactly.
No.
However, some do respond beautifully. And I think this is really the missing link here, is that under, what is the terrain that we're giving the stem cells? Is the body in a state of repair and can receive them and get the most out of them? So at the clinic that I'm working with, we have some stem cell docs, and they are 100% bought into this concept that you need to be optimized before we get stem cells.
I like what you said about the missing link, because when you look at that chain of events from metabolism going through damage to pathology, our current healthcare system is very good at measuring pathology and damage and having a diagnosis and a treatment plan for that. But we're missing the part that optimizes metabolism. And as Ted said, that spaghetti is now measurable. We can measure your metabolome.
Yes.
And optimize your metabolism. And the result of that is twofold. It optimizes your function now, leading to a higher quality of life, improved sleep, improved energy, improved cognition. And then later down the line, it produces something called morbidity compression. So we make sure the years you spend in optimal health are extended. So you age healthy, you age without a lot of sickness, and then die with a very rapid onset of disease without having to be vertical and ventilated for a long time.
Or die in your sleep.
Or die in your sleep.
You plan on assassination of yourself?
Yes. That's my preferred mode of death. It's by assassination. So
So you're a high profile guy.
I'm renting two people. Each of them supposed to assassinate me. If one fails to assassinate me, the other assassin will assassinate the other. But
Sounds like your way of doing things. Mathematical problem.
Giving this a lot of thought.
of course. But what has been said here is actually I'd just like to narrate my experience. I was asked to actually help in the stem cell program of a hospital. And, I did nutrient and hormone balancing to the patients beforehand. And what happened was that they stopped going to the cell clinic and starting becoming my patients because they said they felt better with what I was doing.
Yeah.
So,
Heard that.
they never consulted anything with me again. But you could see that there's now time. The technology exists to peer inside the cell and take a look at what's going on, right? And at the general state of body, and that Alan says, to take a look at the cell danger response, where metabolites are the primary drivers of it. And as Jup says, this is an investment that you can do now because it's what's the body's doing now. And if it's always like that, then you will have a higher quality life. And a higher quality life is what again?
What is it?
A life without pain.
Yes. And so, one other thing I would mention here that I think is important is that we learn in medical school normal ranges, normal values, right? Which is typically a normal for maybe 18 to 65, maybe 2 to 95, depending on the analyte. And what we do at Health Optimization Medicine is shift your biology back to when you were optimal. It's not normal ranges. You don't be normal for 55 or 60 and be optimal, right? And you can look at metabolism. You can look at the spaghetti drawing in front of you. You can measure a lot of these analytes, and you can shift all those numbers to when you're most optimized, between 21 and 30 years of age. So something you said to me way earlier, Ted, was about, instead of looking for patterns of disease, can we look for patterns of health? And that really just struck me, right? Because that's really what we're doing.
Yeah, and instead of looking at disease markers, can we start looking for health markers? And that's my big quarrel with lifestyle medicine. Again, you're going to adjust the lifestyle of the person in order to address a particular disease. That's not necessarily right? You want to actually boost the health of the person, not just mitigate or diminish the disease. And then what? You have 5 different diseases with 5 different lifestyle approaches. And, that's already the crap that we're in right now. And we're just adding more crap by doing that.
So in the end, aging is a chronic disease, or chronic diseases are aging. I think you can go both ways. And so if you're thinking about this as a reclassification from clinicians, from people that are in practice, seeing people all the time, I think philosophers and what is Aubrey de Grey? He's a
biogerontologist.
It sounds pretty and great, but he's not actually seeing people in practice, right? And I think that what we do as a collective at Health Optimization Medicine is we are, as Dr. Ted likes to say, we are in front of a person. What are we going to do right now to help them? And this is the framework that we use amongst many that you're going to hear about on this podcast. Anything else, guys, or should we wrap up?
Let's wrap up.
Okay. Thanks for listening to another episode of the Health Optimization Medicine podcast. We really appreciate you being here. Gentlemen, it's good to see you, being in person, and we'll catch you next time.